this measure today. And as I do so, I'd like to direct members' attention to my entry in the Register of Members' Financial Interests. So I sit on the Health and Social Care Select Committee, and at the committee we heard from 2 patients only yesterday morning who talked very clearly about the delays that they faced accessing care in the NHS. The first was a lady called Shirley Cochrane, who very sadly had an aggressive form of breast cancer. During her time on an NHS waiting list, waiting for treatment, she felt alone, she felt that she wasn't listened to, and she didn't get the attention that she needed. The second was a gentleman called James Wilkinson. He had myocarditis, a condition that I know a little bit about myself, having had that condition in the past. And again, while waiting for an aortic valve replacement surgery, had that cancelled 3 times. Mr Deputy Speaker, we do face an enormous challenge. At the same committee, we heard from the Health Foundation that talked about the enormous sums that would be needed to solve this backlog. They also talked about the number of consultants, NHS staff, nurses that will be needed to increase capacity in our NHS. And members opposite, honourable members opposite, need to understand that if we're going to do this, face up to the enormous challenge that our NHS and social care system is facing, it has to be paid for. It can't just be borrowed. And if they've got a better way of paying for this, they need to outline that now. But I also say the lady from the Health Foundation yesterday, when she was giving evidence to our committee, said 3 things were needed to resolve the backlog. And those 3 things were more money, more capacity, and a plan. Now, I've been involved in health politics now for probably 15 to 20 years, and every single review that I've seen the NHS conduct, it needs more money, it needs more staff, and it needs a plan. And that's happened under Labour governments, and it's happened under Conservative governments. So if we are going to go ahead with this plan, a plan that I support, we need to ensure that that goes with reform and innovation too. I'll happily give way.
Would he accept, with his wealth of experience in the health politics, that we do not know, because the Secretary of State for Health has not outlined how many of all the people on waiting lists will actually be seen and dealt with, and that this is a bit of a blank cheque?
Well, we're not going to approach that backlog unless we have the money, the capacity to fund it. And it needs to go hand in hand with what I said, which is innovation, new pathways, new ways of working. Again, I remember talking to someone who told me that we've had 3 years' worth of innovation in the NHS in just 3 months. And that was a pandemic that caused that. New ways of working, new pathways adopted. And these new pathways can be adopted. And again, in my experience, every time we've talked about innovation in our NHS, every time we've talked about new pathways, there's been accelerated access reviews, there's been innovation health and wealth reports, there's been the new life sciences strategy, and all of them talk about innovation and new ways of doing things in our NHS. But they need to be spread at pace and at scale. There is no excuse not to do this now. If it works in one part of the NHS, Mr Deputy Speaker, it's going to work in another. And culturally, the NHS needs to grasp that nettle, spread that innovation, new ways of doing things, so we can get productivity and outcomes for patients. Now is the time to do that. Of course I'll give it.
Back to social care. The Select Committee, which is a member of, the Health and Social Care Select Committee last autumn, estimated that there was a gap in funding in social care of £3.9 billion. That was the figure from the Select Committee. I presume that he agreed with that report. Can he explain, therefore, how this levy is going to deliver £3.9 billion a year for social care? Because I haven't seen any figures which show that at all.
Well, Mr Deputy Speaker, what I will say, what's not going to give the £3.9 billion is no plan. Yes. And that's what members opposite have indicated today. There is no plan. This is a significant tax increase. I'm a Conservative. I don't like tax increases. But I also understand that this great, enormous thing seemed to happen before the last manifesto, and now. And it was a global pandemic. And people who got opposite, members opposite, seem to have missed the fact that it was a global pandemic and that we need to shorten waiting lists, we need to do something about it, and we need to correct it. No, I've given way twice now, and I'd like to continue, because there's another really, really important point I want to make. Because yes, this tax and this levy needs to be accompanied by reform. And there's a real health reform bill going through at the moment, which is really, really important. But one of the reasons we're able to power through elective waiting lists, was because of the way incentives are geared within the system. We pay for care by a system called tariff. And I would just urge honourable members on the front bench and others to think very carefully about how we're actually going to pay for elective procedures in our NHS, because any system like tariff needs to be able to ensure, quite honestly, that hospitals are paid properly for the procedures that they're doing. There needs to be the proper incentives to deal with hip and knees, cataracts, hernia operations, the big operations like this, which will be the majority of the backlog, as well as the cancer, the heart conditions and everything else. If we're not able to find the right systems, the right levers within our NHS system to make sure we can power through those elective procedures, then we're not going to be able to solve some of the more kind of serious operations at the end of it. Things like innovation tariffs as well, I think, would also help to try and encourage new ways of doing things. We can't have a system where financially trusts and our NHS are not incentivised to do the things they need to do, become more productive. They can't look at short-term financial measures when what we really need are those incentives to make sure that they do the right thing. So I will be marching through the lobby supporting the government today, because this is really important. If we don't grasp the nettle of NHS reform backed by finance, so our NHS staff also have the bandwidth, I've given away a few times, also got the bandwidth to deal with the reform that's needed, and that bandwidth is capacity and money. If that doesn't happen, then we're going to borrow more, we're going to spend more in the long term, and this ever-lasting round of more staff, more money, and a plan is going to go on and on and on. So I urge honourable members to support this bill, support this measure today, and support the government.
Clive Batts.
Thank you.